So, honestly, firstly, good afternoon, everyone. Thank you very much for having me here. It's genuinely an honor to speak at obviously the Global Summit for Mental Health and Wellbeing. And honestly, being here today means probably a lot more than what people realize. Because my journey into mental health advocacy didn't begin in a university lecture hall. It didn't begin in a boardroom. And it certainly did not begin with me believing that I'd be speaking here. It began in trauma, survival, in chaos, in trying to understand why some people break quietly while the world carries on around them. So today, I don't want to give you a polished corporate talk. I want to give you honesty. Because while mental health conversations are improving globally, there is still a huge disconnect between systems and lived reality. We have frameworks, we have pathways, policies, strategies, assessments, waiting lists, risk thresholds. But despite all of that, people are still suffering deeply. People are still falling through the cracks. And many people who need help the most are either disengaging with services completely or never accessing support in the first place. And that's why my talk today is called From Survival to Stability: What Actually Helps When Mental Health Services Aren't Enough. And I want to be very clear from the beginning. This is not an attack on mental health professionals or services. I have huge respect for clinicians, support workers, nurses, therapists, crisis teams, and frontline staff. But many are doing incredible work inside systems that are overstretched, underfunded, and overwhelmed. But I think we also need the courage to admit something. Sometimes systems keep people alive without helping them rebuild a life that actually feels worth living. And there's a huge difference between survival and stability. Survival is waking up every day trying to simply make it through. Stability is finally being able to breathe again. Survival is functioning externally while collapsing internally. Stability is feeling emotionally safe enough to reconnect with yourself and other people. Survival mode is exhausting, and I know that personally. So I've experienced a lot of trauma growing up: abuse, instability, fear, emotional chaos. And what trauma does over time, it changes the way you experience the world. It stops you feeling safe. It stops you trusting people. Your nervous system becomes constantly alert. A lot of people think trauma is just memory. It isn't. Trauma lives inside the body, in hypervigilance, in emotional shutdown, in anxiety, in numbness, in self-destructive coping mechanisms, in burnout, and in feeling disconnected from yourself. And many people become experts in hiding it, like I was. And that is something I think we massively underestimate in society. How many people are walking around functioning externally while they are fighting battles that nobody sees? People go to work while suicidal. People parent children while they're emotionally broken. People smile while they're drowning internally. And eventually, survival mode catches up with you. For me, that happened a few years ago. And when I found myself standing on a bridge, prepared to end my life. And I'm going to say something very honestly today. Pills didn't save me. The system didn't save me. A passerby saved me. A human being noticed another human being in pain. Somebody stopped. They cared enough to call the police. Somebody interrupted that moment long enough for me to still be here speaking to you today. And to this day, I still think about it, being completely honest, because maybe that person understood something. Maybe that person recognized pain because they had experienced that pain themselves. And that moment changed how I viewed mental health support because it showed me something incredibly important. Human connection can reach people in ways that systems sometimes can't. And again, that is not a criticism of services. It is recognition that human beings do not heal through systems alone. People heal through connection, through safety, purpose, community, understanding, consistency. And one of the biggest reasons I believe lived experience matters so much is because people who have lived through the darkness often understand the language of survival in ways that others can't. That understanding creates trust, and trust is everything in mental health support, especially for people who are disengaged from services or distrustful of systems. A lot of people carrying trauma, they already feel misunderstood before they even walk into a room for support. And if the environment feels clinical, rushed, judgmental, or emotionally unsafe, they shut down. And not because they don't want the help, but because survival has taught them vulnerability is dangerous. And I think one of the biggest problems we face within mental health systems is that people can unintentionally become data instead of humans. Now, to paint a little bit of a picture, about a year ago, I attended a new patient appointment at a GP surgery. Now, they measured my height and my weight, and they entered it into the system. According to that chart, I was overweight. Now, the reality, I'm skinny. And I remember laughing afterwards because I thought that perfectly sums up what happens in many systems. Something can look accurate on paper while being completely inaccurate in reality. The chart made a judgment without actually seeing the person standing in front of it. And mental health systems can work the exact same way. So somebody can attend appointments while still feeling deeply alone. Somebody can meet criteria while nobody truly understands what they're carrying internally. Somebody can appear functional externally while privately collapsing. We can become so focused on forms, thresholds, pathways, and diagnosis that we unintentionally forget the human being underneath it all. And that's what I've learned through both my own experience and the work that we now do from the Fynix project. So people heal in environments where they feel safe, understood, connected, and useful, not being judged, not being processed, and just being understood. That understanding changes everything. One thing I've realized is that many people struggling with mental health are not simply battling symptoms, they are battling hopelessness. Hopelessness is one of the most dangerous emotional states a human being can experience. Because when somebody loses hope, they stop believing things can improve. They stop reaching out. They isolate. They disconnect. And eventually, they begin emotionally withdrawing from life itself. And this is why community support matters so much, not because it replaces clinical care, but because it fills gaps clinical systems cannot always fill alone. Services often focus on crisis stabilization, sorry. But human beings also need belonging. They need identity. They need purpose. They need routine. They need meaning. And they need connection. People need reasons to keep going. And this is where lived experience led support becomes incredibly powerful. Because when somebody sits in front of a person who genuinely understands survival mode, something shifts psychologically. Walls lower, people feel less ashamed. They stop feeling like they're being analyzed and start feeling like they are being understood. Now, at Fynix Project, this is exactly what we try to create. Not polished perfection, not clinical jargon, but human first spaces. We focus on trauma informed support, emotional regulation, practical coping strategies, behavior understanding, creative expression, storytelling, community connection. And one thing we consistently notice is how quickly people engage when they feel emotionally safe. Sometimes somebody can spend months waiting for formal intervention through overstretched systems. Yet within one workshop, one conversation, or one supported environment, they begin to open up for the first time in years. And that matters. And again, this is not about saying community organizations are better than the NHS. The NHS is carrying enormous pressure in the UK. Demand is rising constantly. Professionals are burnt out and waiting lists are growing. So while somebody is waiting 6 months, 9 months, or over a year for support, life is still happening every single day. Trauma doesn't pause because somebody's on a waiting list. Suicidal thoughts do not pause. Depression does not pause. Isolation does not pause. And that is why community-based organizations are essential, because early intervention matters. If somebody can access support, understanding, emotional safety, and practical tools earlier, we often prevent deeper crisis later. Now, this isn't just compassionate, it is practical. This is where I believe government policy urgently needs to evolve. At the moment, lived experience is often treated as an optional extra, a consultation at the end, a panel appearance, a token voice included after systems are already designed. But if we genuinely want to be more effective with our mental health systems, lived experience must sit at the forefront of policy and procedure from the very beginning, because people who have been closest to the issue are often the closest to the solution. Now, that does not mean removing professional expertise. It means combining expertise with reality, because lived experience identifies things that data alone cannot identify. It identifies why people engage or disengage, why certain environments feel unsafe, why some language creates shame, why some approaches unintentionally re-traumatize people, and why trust breaks down. And more importantly, what actually helps people feel human again. Imagine if policy was co-designed with people who have actually survived suicidal crisis, trauma, abuse, and severe mental health struggles. Imagine if emotionally safe environments were prioritized as heavily as targets and metrics. Imagine if prevention was valued as highly as crisis response. Imagine if community organizations were funded not as emergency add-ons, but as essential frontline support. Because prevention is always cheaper than crisis. Emotionally safe communities reduce pressure on hospitals. Early intervention reduces crisis admissions. Connection reduces isolation. Purpose improves well-being. Trauma-informed practice reduces escalation. And these are not just compassionate ideas. These are scalable, practical, evidence-informed approaches rooted in human reality. And I think one of the biggest shifts we need culturally is we need to stop viewing people purely through the lens of what's wrong with them and start understanding what happened to them. That shift changes the conversation completely. Aggression can be fear. Withdrawal can be shame. Avoidance can be self-protection. Addiction can be an emotional escape. Burnout can be years of unprocessed survival. Behavior often makes sense once pain is understood. And I believe this is particularly important within schools, workplaces, healthcare settings, and public services, because trauma does not disappear when somebody enters adulthood. It certainly didn't with me. It follows them into relationships, into parenting, into employment, into education, into physical health, and into every part of life. This is why trauma-informed practice matters so much, not as a buzzword, but as a cultural shift. A shift away from what's wrong with you towards what happened to you. What do you need to feel safe? And what support would genuinely help? That is a very different conversation. And finally, I want to leave you with this. People are far more resilient than we sometimes realize. I've seen people come back from trauma, from suicidal ideation, from homelessness, from abuse, from complete hopelessness, not because somebody magically fixed them, but because somebody helped them feel seen long enough to believe stability was possible. And that is powerful. And sometimes the most important thing we can offer another human being is not perfection, is not expertise. It's not a perfectly written policy. It is presence. It is human connection. It is safety. It is understanding. And it is hope. Thank you very much, guys. That is all from me.
Oh, that was fantastic. I was putting things in the chat, but that it was phenomenal. And then
I'll be honest, I cannot multitask, so I apologize.
No, no, no. I wasn't meaning it to interrupt. I was meaning it to silently, for hindsight reflection, when you can see, that I was in it with you there, really connecting a lot of the things that you said. We had a great conversation with Stevie Burke previously, who has a lot of overlap in this, and it was phenomenal. The vulnerability that was there was a lot of resonance, a lot of alignment. Many of us have trauma from a lot of different sources, and certainly trauma is perception based. Trauma is not the same to everyone. And so really understanding that non-judgment is not a cliche. It genuinely means that you're showing up for somebody just to be there with them. Maybe they're in it and you're just in it with them for a minute. Just let them sit with that and know that they're not alone, because most of the time that black hole feels like it'll swallow you up and never let you out. And so it's very helpful to just see a shining light who says, "Hey, I see you in there. Are you okay?"
Yeah. Yeah.
It's amazing.
No, you're absolutely right. Oh, it is. It really, really is.
It was
you
it was
mentioned
very
about like the
connecting.
trauma. Yeah. So go ahead.
It was very connecting, Daryl. Actually, initially I was listening, and then while during your speech, I got stuck, and then I was like, I just it was very 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 connecting with you, and rightly said. See, we need there is no. I also, this is very rightly, I believe that no medication in world can help somebody who is hopeless, who is stressed, right? The only thing that can be helped is if he's been seen, that feeling that I am being heard, that feeling that I am being seen, and that feeling that somebody is listening to me, he's there, somebody is there with me. That is all we need. And the point, I you said in your speech, I'm leaving you are going now, you'll end this, but you have left us with a question. why
Go
some
on.
spaces feel unsafe? Why our beloved feels why some our beloved people disengage with us? Why some places feel unsafe? So this is really a question that needs to be answered. Like today, before you, there was Steve Brook. We were talking like children can't approach their parents. Like my friends, I can't, if I'm having some kind of stress, over an issue, I can't approach my best friend. I can't approach somebody. I can tell them because I feel they will laugh over me. They will make fun of me, and then this will again have a stress. So I will take stress of this, and then it's a loop. It's a loop. The person who thinks
Yeah,
more on this, the person who keeps more pondering over this, keep getting engaged in this, and it keeps him back always. This was
yeah.
literally nice to hear from you.
Yeah, and you mentioned about, why kids don't go to their parents, and a lot of that can be to do with likes of social media and how things are perceived in like the mainstream media and stuff like that. So to give you an example, I was groomed by my mother's boyfriends when I was 11 years old, and I didn't speak to anyone about that for 20 years, and that's because I was always thinking, because you'd see it on TV and the news and stuff like that, and I would always think, what are they going to think of me because that's happened to me? But I'm a guy that shouldn't happen to me. So there's always them sort of things, and I couldn't speak to my parents because I was asking them questions as well. Was it my fault that it happened? Was it my mother's fault that it happened? I was pointing the finger at everyone else, and I couldn't speak to my mother about it because in my head, as an 11-year-old, I didn't know, whether she was to blame or whether he was to blame. I didn't know that at all. So it's how things are perceived in the media, in the mainstream media, and especially when you're a kid, stuff like that, you're not comfortable talking about it, and it's hard to process your emotions. So if we have a space where children can speak openly, and I mean, we've started doing work in schools as well, and I talk openly about my story, about everything that I've gone through. I talk openly about it because if I can relate to someone, doesn't matter what they've been through, but if I can relate to them in some way, they will open up, they will lower them walls, and we will start getting somewhere. So every ounce of pain that I have felt in my life, that's now turned into purpose, because in some way, shape, or form, I have been where they are. I mean, what I've been through in my life, and it's not, I'm not showing off or anything, but I was doing a podcast the other day, and I sort of went through everything that I'd sort of dealt with, and it's called the Minds on the Mersey podcast, and the mental health podcast, and they said, what you've been through, I'm surprised you're still here. It reads like a CV, what I've been through in my life. So in one way, shape, or form, anyone that we speak to, I can always relate to them in some way. And that's what we're trying to do, is using that lived experience to help lower them walls, to build that trust and build that connection.
Phenomenal. I was just going to add, for everybody, that I do have, this speaks perfectly. I have an affirmation that I say, and it really kind of speaks to what you're saying, which is, through my body, through my voice, and through my presence, I transmute pain into power, separation into belonging, and fear into remembrance of who we really are. It takes that second for me, as a sexually abused child many times over, molestation, attempted kidnapping, drug abuse everywhere around me, constantly being unsafe, constantly being unseen. When you open up now as a bedside, nurse for the 16 years that I did labor and delivery OB care, when you are in that intimate space with somebody and they say, no, I can't breastfeed. I'm not doing that. I can't have my baby on me. Or what they flinch when you touch them. See, there's people without lived experience that'll just say, oh, she's a little jumpy. When you have lived experience, you say, ooh, maybe she's like me. It really just helps to connect. It really does. And when they sense that authenticity, it's almost like an unspoken language, and you just bond instantly. I have had immense healing both ways with my patients because I have sat with them and heard them cry and tell me to my face, I have never told anybody this in my life. Those types of things never leave you. And thank you, Darryl, for your bravery. You are not unique, unfortunately, in your experiences. Most sexually abused children are not. And it's so terrible because statistically, it would make you think we are. We're really not. It happens. And your bravery for speaking up to other children really can change that moment. It can be one person just telling them it's okay to be not okay about this because it's not okay. And really talking about that in a way that's very open. I think that children really need to have that because there's so much contrast, and it's a wonderful presence you have. Thank you.
Oh, no, I appreciate that. And thank you for sharing as well.
I would also like to add here that we people like us don't want others to suffer because we can feel that. We get it how it feels to be unheard, how it feels to be lonely, right? So we don't want others.
Yeah.
So we want a society that is happening. We want a society that is full of joy because people are engaging together.
Yes,
Yeah.
empathy, I feel like, is the pathway that Darryl's been talking about. True, genuine empathy. Even if you don't have it from a lived experience like that, you can certainly resonate very closely with some injustice of yours, some misunderstanding, some immense confusion, some terrible trauma that you've had that you could relate to somebody else's experience and just feel or recognize that they're in immense pain. You don't have to understand it deeply in detail. You just have to recognize that this is a human being who is living in such pain. And I know pain as well. And that's enough of a connection. We have so much in common that we could connect on versus differences that the details, although they do matter, I'm not saying they don't, but I'm just saying in the form of, this context where it's that just bonded connection with another human. You don't necessarily need to know every detail. You just need to know enough to say, I'm here. I'm here with you through this. I'm right here. Fantastic.
And I agree. I think that the empathy goes a long way, even if you don't have that lived experience. If you look at likes of GPs, if you're going in with a mental health issue, they're listening to respond, and that's something that I always, it grates on me quite a lot. But they listen to respond because they already know what they're going to say, and what solution they're going to offer before you've even finished speaking. But if they, instead of listening to respond, if they listen to understand, then things will be a whole lot different. But I think that's clearly a policy change within the government as a whole and the professional services as a whole. But I think that's something that we absolutely need. Listen to understand instead of listen to respond.
Yes, and also maybe including more volunteer services, maybe more patient-led, pop-ups or involvement. I love the fact that you have identified it's not to slam any systems. There's no perfect, entities out there or systems, and so that's not the focus. The focus is, well, we did notice gaps, but the whole intention is to be able to fill them, not to blame the gap. It's to be able to notice them, assess them, and say, hey, okay, let's meet it. Let's do what we can do and fill this gap as much as possible in the ways that we can that are sustainable and really meaningful. So absolutely. Yes. And then it's like, wait a minute, what? And it resets the perspective back, so wonderful.
I would add that the people who has gained it by themselves knows how to transfer it to others. We can now I can now teach. I have taught many students to speak other languages in a very simple way, like learning English or speaking any other language. I'm just giving an example about English. That it is seen as tough, right? And there are many YouTube tutorials, then there are coaching academies, and it becomes a fight for a student, for a person to join, how to speak, and then the person moving from one coaching to the other and not having getting the result, the kind of result he want. and then it becomes he feels same, he feels inferior. So person who has tried it himself gives better, easy and reasonable ways for others, rather than those curated coachings. And I am
It's
just
good the
an
way.
example.
So go ahead. There must be a little bit of a delay.
Thank you, thank you. I'm just giving an example of speaking because it is also it somewhere makes you stressed, right? It is somewhere disturbing your mental health. There are many other scopes, there are many other points, and I believe your project, Fynix project, is doing wonderful.
I appreciate that, but you mentioned about obviously the speaking. Like I see that as you've reframed that. So people have told you that you can't speak English, but you've went away, you've taken that and you've reframed that and said, well, I can speak English and multiple language. You've changed your own narrative and you've reframed things. And that's something that we teach in regards to like reframing and stuff like that. But that's the physical point of reframing. You physically reframed what they said to you. You've taken that, you've reframed it, and do you know what? You can look at them now and say, look at this. English and so many other languages. Oh, thank you very much.